Dr. Monica Ghandi, infectious disease doctor and professor of medicine at UCSF. Thank you for joining us. Doctor, I want to ask you, because when we hear the director of the CDC say something so emotionally, everyone, the hair on your arm stands up. It's frightening. However, we have the data, which most of us believe in science, but then you look at what's happening in Texas, which threw caution to the wind, and the numbers, if I'm reading correctly, the numbers have been going down in Texas. What are we missing?
The way I've been thinking about this, and in your comment about Texas is relevant, and same thing is going on in California, is that right now what's happening is all dependent on our vaccine rate. So this is exactly what happened in Israel as they were rolling out, and they had hit this trajectory of number of people vaccinated. The cases still weren't going down countrywide, but the hospitalizations were going down in those who are vaccinated. If you do a careful analysis, that is what's happening in the United States. People who are going in the hospital with COVID-19 right now are those who are unvaccinated. What Dr. Fauci said in the same White House briefing this morning is he said, if you get a vaccine, you're not going to go to the hospital because it prevents severe disease almost 100%. So I think we have to focus with our eye on what's important, is that our hospitalizations are reflecting those who are unvaccinated. We got to get everyone vaccinated more quickly. And I really commend President Biden and the task force for getting April 19th as our new date. So I want to focus on the positive as well. And again, showing us again, this is exactly what happened in Israel and the UK. Cases started going up, and then we reached a curve of number of vaccinated, and then they plummeted.
So, Doctor, you're right to point out all the positives right now. There certainly is a lot to be encouraged about, a lot to be pretty happy about at this point in the pandemic. But I think that does bring up the question, and President Biden talked about it earlier this afternoon, just about the pace of the reopenings and whether or not states, and since we are seeing the number of cases plateau, tick up, yes, in some states, since it doesn't continue to decline, should states then maybe pause some of their reopening efforts, at least for right now, until we get more Americans vaccinated?
I think that states that are opening too fast or that cases are increasing, they can definitely either pause or keep restrictions. You just mentioned that Texas actually wasn't one of them. So I would do that on a state by state basis, that if they're increasing cases, just stay where you are, or if you've eased a lot of restrictions, go back somewhat with restrictions. This is a temporary holding pattern until we can get more vaccines. So I think that's a very fair point. But evaluate it state by state, only because that's a fair thing to do, right? Like that we are all not increasing at the same rate. California also very low cases. Today, for the first time, 1 death in LA County from COVID-19. 1. 0 deaths in London today for the first time in 6 months of the pandemic. These vaccines are working.
When you talk about these vaccines, too, the president announced it's a more than doubling of the number of pharmacies nationwide that will now administer the vaccines. I mean, we get my flu shot at the CVS. It seems like this would have been a more natural way to do it. What do you think of the plan? I think he said 40,000 pharmacies nationwide start giving the shots by that date he then threw out in April.
I love the idea of pharmacies giving out the shots, like you just said. Everyone kind of knows their local pharmacy. And I compare it to England, which has a national healthcare service. So everyone kind of knows where to come. Here, we've been a little more ad hoc with our mass vaccination sites, which are very important as well, with our clinics. But pharmacies, like you just said, everyone sort of knows and is within 5 miles of a pharmacy. So I love the idea of this. If you've had a history of a severe allergy to vaccines, hang around a bit. Let the pharmacist watch you. They know how to ensure that there's no allergic reactions, and then go on your way. And that's your shot.
Doctor, real quick here, we only have about a minute left, but the Biden administration, as well as some companies, are working to develop a standard for a vaccine passport. That's what they're calling it, as they try to reopen not only these various states, but also international travel. Will this be something that you think could significantly help in the manner of doing this in a more safe way?
I think before people have widespread access to vaccinations, it's sort of unfair, right? Because there are people desperate to get the vaccine and they haven't been able to get it. Let's wait until people, decline to get it, say. But they should certainly have the opportunity to get it. So I wouldn't do that now. However, one thing about international travel, that's always been a thing. You actually aren't allowed to enter countries without a yellow card showing you have different vaccinations. So I think international travel, probably healthcare worker sites, and some schools are going to eventually require proof of vaccination. And that's always been a thing. So I doubt that's going to change for COVID.
Dr. Monica Ghandi, infectious disease doctor and professor of medicine at UCSF. Your voice and your comments are just very calming, especially after what we saw from the CDC director. Thank you very much for joining.